Hi, I'm Tyson Franklin, and welcome to this week's episode of the Podiatry Legends podcast. With me today is another podiatry legend, Matthew Cichero. He is a consultant podiatric surgeon in the UK, and he is also a podiatric surgeon in Australia. We go back a few years. I met him before he had grey hair and when I actually had hair. So, Matthew, thank you for coming on the podcast.
Thanks, Tyson. Thank you for having me. I've been sort of keeping an eye on these podcasts and kind of wondering, you interviewed my registrar, Andrea Gledhill, a couple of months ago.
Yeah.
And I shouldn't say my registrar. She's the registrar working with us at the moment. And I said to her I said, what? You've been asked by Tyson on the phone before I have. I could not believe it. Anyway, so every opportunity I've sort of been saying, yeah, finally got on.
Yeah, anyway, well, I have this long list of people that I want to get on the podcast, but like once you've been in the profession over 30 years, you know so many people, and if you know me and I haven't got to you yet, I probably will get to you at some stage.
Mate, it was fine. And listen, she's a fantastic individual, and just she's just really funny to be around, really nice and very clearly very smart, but really super capable. You can just throw quite a lot at her and she can cope. And when she's not, when she needs help, she calls for help as well, which is a really valuable skill. Anyway, so yes, so here we are. So thanks.
Here we are. Okay, so we're going to go back a little bit. You told me before I press record that you graduated in 95, and that was at QUT in Brisbane.
Correct.
And that would have been the same campus, would have been George Street campus back in those days?
It moved just as I was starting.
Okay.
Yeah. So we were the first cohort in terms of new grads to go to Kelvin Grove. So it was nice, very nice.
All right, you got the new flash clinic.
Yeah. So and we had, I was saying to really early influences of Phil Perlman was a major influence in my career and others around us as well.
So you graduated in 95. Then what was your first step? Once you graduated, what did you decide to do first up? Before becoming a surgeon?
Yeah, absolutely. So the first thing I wanted to do, and again, heavily influenced by Phil and a bunch of people around me the year above me, I wanted to get some holistic sort of overall medical management skills and so forth. So I applied to Singapore, to what was Topayo Hospital, which was a small cottage hospital in Singapore, that then moved to Changi General Hospital. So went there from 96, 97, 98, returned end of 99 for that, to back to Australia.
What was it like working in Singapore?
I loved it. Great. Just totally immersed myself in it. I didn't have the salary of an expat, but rubbed shoulders with all the expats and just, had a great time though. Alcohol was so expensive. So when you had the cheaper booze nights, you got absolutely rocket fueled for a night.
I've been to Singapore twice, and and that was one thing I know straight away, that the alcohol prices are, they complain in Australia, they have no idea. In Singapore, it is over the top. However, like my sister-in-law pointed out at the time when we were over there, have you seen many drunks running around? And
exactly.
No, and she said, well, maybe there's a method to the madness.
Yeah, absolutely. So that was really awesome 3 years. Learned a lot, made some lifelong friends there, and kind of springboarded me into helped me really a lot in terms of immersing yourself into the medical model and understanding multidisciplinary teams. I learned a lot about diabetic foot, high risk foot stuff there. And then because you're such a central hub, managed to meet a lot of really quite amazing surgeons from around the world who would pass through Singapore and do sort of 1 week meets and stuff. So I Phil Perlman introduced me into surgery, but then also that helped me really get a taste and flavor for pod surgery and how we can help diabetic patients as well, and so forth. So that was really fantastic and great experience, life experience,
Yeah.
just generally with life.
So when you finished Singapore, you came back to Australia. When you came back to
Mm.
Australia, was it with the intention that you wanted to go down the surgical path, or did you then
Yeah,
work for a few years in Australia
that's
before
right.
making that decision?
Yeah, no. I started my master's in, I think that was early 2000, I think. I came back to Australia because I realized if I was going to follow that path, kind of felt like the right time to come home anyway.
Yeah.
And so did that, worked in Blue Care up in the Sunshine Coast, did a couple of other jobs, and also opened up a private practice there, which then over the 7 years, so from 2000 effectively to 2007, Queensland Health, Blue Care, a private practice, doing your masters, having children and so forth. And
Yeah, that's a lot.
yeah, it was a fair bit. And yeah, and so started a practice with Barry Matthews, or so I started solo, then Barry Matthews and myself joined together,
Yeah.
and which was fantastic. I'm sure I was probably the most frustrating business partner to have, because my head was in the clouds and all clinical, and he was very business focused.
Yeah, well, I was going to say,
So
with all the stuff that you were doing as well, time management would have had to have been really important to
yeah,
be
yeah.
doing all that.
It is. Probably ask Barry that question when I did it particularly
Yeah.
well. So I'm not going to say whether I was good or not, but you just have to fit in what you can fit in, and you do have to compartmentalize your time, I guess. And when, with kids, would study until about sort of, I don't know, 10:30, 11. We had twins as our second lot. And so it was then staying up late enough to help my wife feed the twins at the
Yeah.
late night feed, and then head to bed, and then you're up at
Uh,
2 or 3 and whatnot. So yeah, it was challenging times, but you know, um, if you get through it,
the
yeah,
thing I like about this is you've proven that it's possible. You can make
yeah,
anything work if you really want to do it.
yeah, absolutely. Yeah, so that's where that transition, and then I started my actual hands-on surgical training with Rob Herman in 2003. So that was fantastic. I'd already had a reasonable amount of experience in Singapore, because I used to go into theatre with one of the orthopedic foot and ankle guys who
Yeah.
again was just such a great friend and mentor and supporter, actually, interestingly enough. So yeah, so Australia ACPS around 2003, and then I know you've had Rob on and listened to
Yeah, he's
him,
been
and
on a
he's
couple of
got,
times. Yeah.
yeah. So in terms of someone who's persevered and overcome a lot of adversity, he's one guy that's done it. But unfortunately, because of the significant orthopedic resistance, I guess,
Yeah.
he was uh, suspended from surgical work, and then I had to make decisions. And I tell you what, I'm sort of looking at some of your other podcasts, and you talk about points where you really have to ask yourself, why am I doing this? Do I really want to do this? Is this the path you want to go down?
I think that's with everything in life.
Yeah, there are so many forks in the road. I mean, I sat the GAMS when I was in Singapore. I sat the GAMSAT exams because should I be doing medicine and then orthopedics?
Yeah.
So I passed the exams and did pretty well in them, but I didn't get interviews.
But
And
I had
it's
another
so
guest on, Remy Statkis, and Australian graduate, and he wanted
yeah,
to go down the surgical path. But yeah, with some of the things that were happening, he decided to go to the United States, and he did the
yeah,
whole DPM program, had to do it all over again. And now he's in Chicago as a podiatric surgeon, absolutely loving it. And I
yeah,
don't know how many years he's been there for now, but it's funny when you meet him, you keep thinking he's going to have like a slight American twang because he's been there for so long.
yeah.
And as soon as I saw him again this year, he's like, "G'day, mate." He's a funny guy.
I would have to meet him. I'm going over to America to the ACFAS, American Foot and Ankle, so conference in Tampa.
I'll put you in touch
which,
with each other through
really good.
through social media. I'll just do a bit of an introduction because I
Lovely.
think you'll both get along pretty well.
Yeah, yeah. So when Rob went through that, and I went through it as well. It was predominantly Rob, but we were still caught up in those elements.
Yeah,
Registrar, so it was really hard and really soul searching sort of time. So I know what's been going on in the media this week back in Oz. So it's tough. You go through these tough periods. And so I kind of had to or my wife and I needed to make a decision. If I was going to continue on the path, two choices: either head to the other side of the country and head over to Western Australia,
yep,
or I'd just come back from doing a 3-month rotation in the UK in the hospital I work now with Ben Yates, or do we just pack ourselves up, the kids, all of us, and just head over to the UK and head there for 12 months, do a really final intense period of surgical training, then come back to Australia. So that was the plan back in 2010, because we didn't know how long Rob's thing was going to go on for.
yeah,
And it was just, you know what, I've got to do something. Because I made the decision there, do you know what, this is what I want to do. I just felt that drive and that pull. I didn't have anyone in the family that was surgeons. My father was a pharmacist. He was also a minister in the Anglican Church. My sister is a nurse, intensive care nurse. One of my brothers is a dentist. My other two brothers are not medical at all.
yeah.
They faint at the sight of blood. One of them does.
My brother's a dentist and he faints at the sight of blood. But only if it's his own blood. If it's anybody else's, he doesn't care. Their jaw could be hanging off. He said it doesn't bother him. But if he gets a scratch, he just gets wobbly legs. Yeah, it's funny.
Hilarious. So you get those influences, and I don't know. I felt, for me, maybe it was I don't know whether I necessarily felt I was trying to prove myself. I don't know. I maybe an element of that. I went to a boys' school in Brisbane, and it's pretty academic, and so I think sometimes that does influence you to think or to challenge yourself and to push yourself.
100%. I agree. Like, I went to a state school, and it wasn't the best state school in the world. It's probably one of the worst ones in Brisbane. And when you're there, the whole mentality of that school is just survival. If you can just survive and get out of school and then actually do something. And all the guidance officers in that back then were all like, maybe you should get a trade. Maybe you should do this. And I'm like, I don't want to do that. I want to do something completely different. And my brother did dentistry, which sort of helped me go down the allied health path. I actually think, being at a private school, their mentality is completely different.
Yeah.
And where success is sort of expected. But I think it's not just what happens at private school. I think when you actually get out, I think this is a really important point. When you graduate from podiatry, who you hang around when you first graduate, and the conferences you go to and the people you meet are going to directly influence your career. Yeah. And I don't think people realize that. If you hang around dumbasses once you get out, and the podiatrists who, I don't know if they really wanted to do podiatry or not, and that's the group you hang around with, you're going to struggle mentally, I think, to have a successful career.
Yeah, I couldn't agree more. I think in those 3 years in Singapore, I was really fortunate. I did a 1-week fellowship with David Armstrong and those guys in San Antonio, conferences in Helsinki, conferences in the UK, and then just around that region. So it just opens your mind, and you're doing grand rounds with guys, and you're going, wow, there's a lot that I don't know. So that's what you do. You find out, actually, I'm just a little fish in this pond here. I need to work out a lot.
Yeah, I did. I look back at my early career, and I bumped into Rob Herman really early, Simon Bartold really early, and I got on with them, and all of a sudden, and then they introduced me to other people that they knew. So I was sort of fortunate to meet the right people at the right time early on in my
Yeah.
career, and I could see what they were doing, and I've gone, oh yeah, I want to be more like that, not this other group that I was actually trying to stay away
Yeah.
from.
Sure. Yeah.
So what
No,
was the pivotal
definitely.
thing? What year did you decide you're going to go to the UK?
Well, I think when the 3 months that I did in 2008 as part of
Yeah.
my surgical training for ACPS, that really was highly influential. And then when coming back to Australia and realizing that Rob's situation was not going to get itself sorted, or we just could not see the end of the road, it was like 2009 that my wife and I sat down. We pulled out a big butcher paper, as you do,
Yep, it
and
works.
yeah, and okay, what are our options? What are we going to do here? And you just pros and cons and a bit of naivety, and then you go, okay, let's just go with this, and we'll give it a crack. And fortunately, or maybe stupidly, you pack up your kids, and you've got 5 suitcases, and no job to go to in the
Yeah.
UK. So the promise I had from Ben Yates was a promise that he'd train me for 12 months. That's it, and no income. So I had to sort of borrow off the house and use that for 12 months to try. But I did get a job.
Was there
Once
much
I
paperwork
landed.
involved with you having to do all that? Were there
Yeah, so I had, because of
visas and
ancestry. Yeah, so
yeah?
I had an ancestry visa connection, so I could
Okay.
get that. So that was key. If I didn't have an ancestry visa, I couldn't have done what I did. So that was the
Okay.
first thing.
Yeah.
And then I had a lot of paperwork already sorted out in terms of the college and insurance and all that sort of stuff. So that was fine. And also registration with the registration board here in this country. So that was kind of all sorted out. I just didn't have an income. And
Yeah.
so,
Yeah. Well,
and
that's
I
a
didn't have
problem.
a, yeah. So I did a job for about 3 months working for an organization called Chiropody, which is, you're in the back of a shoe store as a
Yeah.
podiatrist. And some funny stories there where, we can laugh about it. We're Aussies, and I'm sort of, this young lady came in and she's got fishes on her heels, and it's the middle of summer. And she goes, why have I got these cracks in my heels? And I've looked at her and I said, it's because you're wearing thongs. And in the UK, a thong is,
Yeah. Up your bum, not between your toes.
yeah, exactly.
So I have this conversation in America every year.
There was an uncomfortable silence. I think to myself, oh, I haven't said anything wrong here. I'm not sure what I've done here. And then it's sort of the pennies dropped, and I've gone, Christ, I'm going to be taken to the registration board here. I was doing that. And then, things just, luck is hard work, being at the right place at the right time, and just taking the opportunities.
Yeah.
So 3 months into it, the hospital I work out at, Great Western Hospital, they needed a podiatrist to coordinate inpatient care so patients been admitted for foot infections, foot sepsis. They needed a podiatrist to help kind of coordinate those patients because they were staying in hospital too long and weren't getting the care quick enough. They weren't getting to surgery quick enough because there wasn't someone coordinating it. It was very haphazard. Vascular surgeons kind of knowing about them, but there's just no tie-up. So they started a pilot to run for 6 months, and they asked me if I wanted to do it. And I said, of course I do, because I'll get paid. I'm working in the hospital. And so we reduced the length of stay of patients in a 6-month period. We looking at the average, and we looked at it retrospectively and then through that period. So we reduced the length of stay from 32 days down to 26 days, I think it was initially.
Yeah.
In that 6-month period. And then the hospital said, is that a fluke? Let's do another 6 months. So I did another 6 months and then came back to Australia, sat my final exams in Australia. The second 6 months, we managed to better it by another 2 days. So we reduced it down to an average of 24 days. So we saved the hospital basically, and then also we reduced the amputation rate. So myself and Ben Yates were then able to get these patients onto surgical tables faster, operate quicker, because I knew, like people, I was immediately being referred these patients and we could just deal with them. So I was getting all my surgical training in elective surgery, and then I was getting all my additional surgical training in limb preservation surgery. So that succeeded. And then at the end of 12 months, they said, we're going to create a job. Could you please go for it? Now, they had to advertise it, but they advertised, very quickly. And I was the only one who applied. And I got the job, and then kind of everything just evolves. And so it became then a consultant podiatrist, but not a consultant podiatric surgeon, because I was still finishing my training. I then had to approach the faculty in the UK and ask them if I could join their training program. And then myself and Ben Yates helped to formulate the first memorandum of understanding of the surgical training in Australia to the surgical training in the UK. And as a result, they recognised then my fellowship in Australia. The UK faculty recognised my Australian surgical training. But then I had to do another 2 more years of registrar training before I could do what's called a certificate of completion of podiatric surgical training, which basically means once you've done that for 2 years, I can then apply for a consultant's job at the hospital or in any hospital. And that's kind of like the golden ticket. If you get a consultant position as a podiatric surgeon, that means you can operate privately as a podiatric surgeon in the UK.
Yeah.
If you are not a consultant, it is a massive step.
Yeah.
So things just kept evolving, and the carrots kept dangling. And you then start also, with your 3 kids, you sort of like the decision is, okay, my wife and my family have given up living in Australia to come here. What can I give them back in return? That's where you got to start. That's where you have to think about. So the return is, okay, if we live here and work here for 5 years, then they can become British citizens.
Yeah.
Dual nationality. And, before Brexit, the world's your oyster, pretty much.
Yeah.
How
old are your children now?
So when we left and when we moved to here, Amelia was 9 and the twins were 6.
Okay.
So now Amelia is 22 and Sophia and Olivia are 19. They're doing their gap year. They're currently in Noosa, actually.
They're living your dream, because in your bio you mentioned that if you weren't a podiatric surgeon, you'd have a longboard and you'd be surfing around the world.
Yeah, exactly. So they're currently with mum at Noosa, with my mum, and enjoying their life, living their best life. So doing that. Can
I ask something for a sec? Because you still sound very Australian, so you haven't picked up any English twang at all. Yeah. So are your children, though, have they got the English accent?
Yeah. But, I can, with Amelia, because when she goes back and sometimes I hear her words and I go, you know what, you've still got a bit of Aussie words there.
Yeah.
My brothers and sisters and cousins would beg to differ. But I was talking to Sophia this morning and I've gone, you know what, there's a twang you're picking up. I can hear it. I can hear the accent right at the end of your sentences. So you can hear them picking it back up. It's quite funny.
But it's surprising how some people, where they can be in a certain environment, they reckon some people are just influenced very easily. They live in another country, they'll pick up their accent very easily. And other people, it just won't affect in any way.
Yeah, that's right.
So you've been there long enough now. If it was going to get you, it would have got you by now.
Yes.
So I don't think that's going to happen.
I would never want it to happen.
Yeah. So do you think you've been in the UK for a while now? Do you think that's where you're going to stay? This is where your career is going to stay in the UK, or do you think eventually you'd come back to Australia?
Yeah. It's that is a really difficult, and I must say it's a question that you grapple with every single year, and particularly at certain times
during winter.
Yeah, during winter, but also when life throws up challenges as well, you sort of go, gosh, you know what? This is kind of hard work. And sometimes you think the grass is going to be greener because, you know, we've the last 12 months have been very challenging professionally in where I work. And that has really made you question. There have been points this last 12 months, and there will be colleagues in Australia who I talk to regularly who will attest to this, and they get very pissed off because sorry if I'm
Oh no, you can say that.
Okay, good.
A lot worse has been said.
I'm sure. So they get very pissed off that still haven't moved back. But mate, it's very hard because you get to a point professionally with podiatric surgery, and then your retirement fund, so NHS, I've got that pension superannuation pot, which is a decent thing. There are these pulls, strings and levers, right? And I think my ideal would be, because I do love the proximity of Europe, and I love the culture around Europe, and part of my other side of my family is Italian on my dad's side, a couple of generations back, two generations back. So I love Italy, I love Spain. France, I really love too. And I've got, you've got a great network of friends. So life is great. If I had my ideal, I'd have 6 months in Australia, 6 months here. That would be bliss.
But I think that's with anybody who lives away from where they class their original home was. Like I was brought up Southeast Queensland, Gold Coast, Brisbane area, but now I live in Cairns, which is a 2.5 hour flight, which is, I'm still in the same state, but the friends and connections and everything I have here in Cairns, I could never see myself living back in Southeast Queensland. But it'd be nice during summer to actually have somewhere down south to get away from the heat.
Yeah, absolutely. Yeah, no, I've worked in Darwin for a year, going up to Darwin, and that oppressive heat in summer can
it's sort of like that at the moment. So, but I could assume living overseas is completely different because like you said, your mum's in Noosa. Yeah, and it's like my mum's down the Gold Coast, and I'm fortunate I can see her a couple of times a year without any problems at all. And I try and organise even some of my skiing events and workshops that I do. Yeah, that's why I do them in Southeast Queensland, because then I can go and catch up with family at the same time.
Yes.
So you must find the same thing. You come to Australia at least every year to catch up with family, friends.
I don't. I try to. I was back in April last year, and I haven't had a trip home. I've wanted to, but things just work against you, and I can't get there. Maybe 2024, but I'm not sure when. It's just it's a bit tricky at the moment, and it has been a difficult 12 months, and so I just have, my headspace hasn't been there, but it's been hard, that's for sure.
So also when you were in Australia, you were on the Queensland Podiatry Registration Board as well.
Yeah, I was there.
So you managed to squeeze that in at the same time while you were doing everything else.
Yeah, that's right. That was with Paul Bennett.
Paul Bennett. Yeah, that's a name from the past, isn't it?
Yeah. So that was really interesting, I must say. That was learning the other flip side of the coin of what regulation means and being a statutory body and stuff. So it was good learning experience, that's for sure. And that was around the Rob situation as well that I was.
You were on the registration board around that time.
Not initially, but then eventually, yes. Yeah. So understanding what conflict of interest is and so forth. And
like it's one of those things, the registration board, I know a lot of people give them a hard time sometimes. And I've had my run-ins with them over 30-something years. You're going to have to deal with them at least once or twice. Cool. And never to do with clinical stuff, just me being me. Yes. And but I'm also an advocate that they need to be there. I bag them at the same time. I'm a huge supporter of the registration board because if they weren't there, there'd be mavericks running around doing the dumbest things.
Correct. Yeah, totally couldn't agree more. So yeah, but anyway, so did a period of that, and was on the Queensland Association for a period of time as well. And then I got voted to go on the Royal College of Podiatry board I was on that for about 4 years, and sort of resigned from that June this year, I think it was. And I've been chairperson of the Royal College of Podiatry conference for the last 2 years running. So that's been a fantastic experience as well. So
yeah, the one thing I've noticed about your career, even though you've done things for yourself to progress your career, but the one thing I've noticed with a lot of people who, they're in your position, you've also given back a lot to the profession. Yeah, being on the association, being on the registration boards, doing the same thing in the UK. I just think it's important, no matter who you are in the profession, to try and give something back to the profession, especially when you get, I'm saying later in years, because you're not, how old are you 50 yet?
Yes, mate, I am.
Okay, I wasn't sure.
No. Mate, we still look as good as what we did back in the day.
Oh, yes, yeah. I can always count. My mum will always tell me I'm handsome. You always rely on your mum. It always makes you feel better. But I do think it's one of those things. It's like the podcast, me doing the podcast now. What I love about it is getting people on here, sharing their stories. And I know I get students all the time tell me, if it wasn't for this podcast, they wouldn't be doing podiatry. They would have left.
Yeah, right. Fantastic. Yeah.
But they'll hear, this story that you're talking about now, and they go, wow, that's the path I want to go down. And I think it lets them know too, there's hurdles. It's not going to be, I'm going to put my hand up and be a podiatric surgeon, and it's a smooth run all the way through. There's going to be hurdles.
No way. Yeah.
But what is interesting, and I think Rob Herman said this when he was on, that, and there were people way before him, that they've put in all this groundwork, and then, he's putting in the groundwork now that hopefully in 20, 30 years' time, all the people doing podiatric surgery will look back and go, how easy is our life now because of all the stuff you guys have gone through.
And just podiatrists generally, without some really pioneering guys back in the 50s pushing local anesthetics because they wanted to do some digital surgery and nail surgery. If they didn't do that, and that group then became morphed into what we know as the Faculty of Podiatric Surgery in this country, and same in Australia, Pickering and those guys. If they hadn't have done what they did, and holy heck, I sort of think about some of the adverse situations that we have come, in Australia, in what they're currently going through at the moment, and what we've been through here and stuff. And if you sort of look at what you're going through personally, and that's your life story, and that's really important. It adds some more texture and tapestry to it. But if you really think back to what they went through and the decisions they made, and far out, really on the edge sort of stuff, and just sneaking things through in a sense, you've got to take your hat off to them, because there's a lot of podiatrists doing what they do in Australia that if it weren't for those guys, for example, getting local anesthetic and other stuff, they wouldn't be doing what they're doing today. They just would not be doing it. So it permeates down. It's like technology in Formula One. It eventually drip feeds down. That's what happens. So, yeah.
Yeah, it's funny. I've never even stopped to think about local anesthetic, because will point out, when I started podiatry, if I had known we had to do injections on each other, I probably wouldn't have done podiatry, because I hated needles. So it wasn't until we got in that I knew we were doing injections, and I thought, okay, well, where are the oranges? Where are we practicing? Oh, no, it's on each other. And I kicked and screamed about that. But I never stopped to even think, right until you mentioning it now, that, somebody had to put their hand up and say, this is what we want to do and why we want to do it. And it wouldn't have been something the government went, okay, not a problem, sounds good to us. They would have fought for that right to be able to use local anesthetic.
Yeah, absolutely. And so much resistance. So I look at what's going on in the media and this week, and I just think, you know what, guys, this is not new. and you kind of got to just weather the storm.
Yeah.
Don't bite back to it. That's actually the worst thing you do. Don't give it oxygen. And the people, for example, so every pod surgeon in Australia, and I still do it, I keep an audit of all my surgical activity, and I do it for the UK as well.
Yeah.
So, and that repository of information sits in Australia and goes to the regulation boards, or can go to the regulation boards, and it's also used for the Medicare stuff that's going on as well. Orthopods don't do it. They don't do it. And even in the UK here, we're collecting what's called patient recorded outcome measures. How did you find the surgery? Did we give you all the information? Did you understand the risks? All those sorts of touchy-feely things. And then also the Manchester MOX-FQ, which is a validated research tool about your outcomes. Did your surgery actually resolve on the parameters of pain, social function, and how you view your feet, if you like, right?
Yeah.
So we're recording all that information. No other specialties doing that to the level that we do in podiatric surgery. So of course there's going to be problems. Mate, I work in the trauma and orthopedic department. I see the complications daily. We review the complications daily. Some of those complications are surgeon error or just surgeon misadventure.
Yeah.
It's not like you go in with the purpose to harm.
I don't think anyone wakes up that morning and says, I've got a patient today. I wonder how much damage I can do to them. No one in their right mind would do that.
And the training is there. The orthopods that I work with will frequently ask me, what would you do in this situation? That's what you do. You sit down, you have a sensible, professional conversation. So, by the time I'd finished my training, I'd locked over 3,000 cases.
Yeah.
When an orthopedic surgeon finishes their foot and ankle fellowship, they have not logged anywhere near those numbers. It's not to say they're incompetent, but they're on a different trajectory in terms of their foot and ankle surgery. So, for everyone who's going through hard times, you've got to sort of always think about, how am I collecting information? How does that help me understand what I'm doing? Does that deliver a better service? Am I delivering a better outcome for my patients? And year on year, I pull out that data and I have to sit down with a mentor, another surgeon, and say, okay, these are the number of procedures that I've done. On average, I've got 99% of my patients understood what the risks were before they went into the surgery. 100% of them knew exactly what to do if there was a complication, those sorts of things. You can report on those things, and that makes a big difference when it comes to people are questioning you. I've got the evidence, guys.
Yeah.
You got the evidence? Okay, you haven't. Okay, well, here's my evidence. I don't care what you're doing, but this is what I've got.
But I think it's something that, well, like you said, it's been in the media lately with the AMA and the orthopedic surgeons in Australia. I think it was on 60 Minutes or something like that. Yes. And I like what you're saying. We don't bite back. It's just keep doing what you do, and don't get in that dogfight, because then it'll be them saying one thing, you saying something, and then the public are the ones that are then going to judge on who can tell the best story. Whereas if we just concentrate on what we do, we don't need to say anything else. We just let the proof is in the pudding.
Correct.
But I like what you said though about how you're doing these self-audits. Even though I didn't do podiatric surgery, pretty much every single patient file that went through my clinic, I reviewed. Every file. Yeah. All the staff that worked for me, every patient they saw, I would daily just review every file that was going through and making sure it was flowing. And some people have said, oh, that would take a lot of time. But once you know what you're doing, it doesn't take that long to just review and make sure the processes are being followed the right way and everybody is happy. And we also did surveys with their patients asking similar questions
Yeah.
about how information was provided to them? Was it easy to understand? Did they know what was happening? So I think everybody should be doing it at all levels.
But this is the thing, and Tyson, just on that is, you're not, okay, it's great, pat yourself on the back if 99% of them are great. What's
Yeah,
that 1%?
they're the ones you're looking for.
Exactly. And this is the thing. So we do regional surgery meetings with colleagues, and and so I've got them to report back on all of these outcome measures, right? So you can pull off the reports quite easily. And I said, guys, I'm not interested. I mean, it's great if you're doing well, super. I want to know what you need to do is reflect on the ones that didn't go well and why. That's what you've got to focus on.
Okay, that's where you learn.
Exactly. Yeah.
Yeah.
You need your outlines.
Yeah, it's a good point, because you can have 100 patients come through with heel pain, and you get 100 out of 100 says, "Oh, that was great." You've learned nothing from that, but you get two that go, "That wasn't good, and this is why," and then you have to dig deeper. There's your learning opportunity. So I used to like it when patients would come back and say, "That didn't work."
Yeah.
Because you'd be going, "Okay, this is good. It means we have to dig deeper. There's going to be a learning from this somewhere."
Yeah. Yeah, absolutely. No, so that's a good part of the journey, I must say.
You've had a really interesting career so far, and I think people are going to enjoy this this particular episode. But I've got a final question for you before we wrap up.
Yeah,
and it's usually, if you were talking to a new podiatrist that was graduating, or someone that's only been out for a few years, or maybe someone that's been in the profession for a while and they're feeling a little bit stale, what advice would you give them for their career?
Geez, that's interesting. So the first tip I would say is broaden your horizon outside of podiatry. So if you are really interested in clinical stuff, don't just go to podiatry meetings. So that would probably be one of the things that I would suggest.
What other meetings would you suggest?
So from my perspective, it was the diabetic foot meetings, which were superb, the international ones, because you learn so much about, endocrinology and a whole range of things. It just opens your eyes up to, holy crap. Okay, I never knew that. Didn't understand that, I don't know, going back in the day, a clotting pathway or whatever.
So would you even say that if somebody's like very biomechanical focused, they should go to probably a clinical conference, and if someone's very, say, clinical and high risk, and that's what they really like, they should actually go to biomechanics to get just to broaden their thinking.
Yeah, so I do biomechanics still. I do Richie Grace's orthotics as well. So I do all of that thing, right? So I'm really interested in to understand. So I get stuff out of the surgical conferences. Yeah, definitely. I get heaps of stuff out of for example, the diabetes conferences. But equally so, you might want to go to sports medicine. It depends what your bent is, but take yourself out of it, right? And take yourself out of your comfort zone and go into an area where you don't know too much about or you want to learn more. It might be in marketing or something like that. It might be going to, I don't know, a business meeting or something like that.
Yeah.
Just find something that you didn't know about that might be really interesting. So that's the best advice I can give to anyone going through at any point in their career. Every day is a school day. I'm chairing the medicines and medical devices committee, and I learned a lot about medicines that way. I go to the rheumatology meetings as well. So you just learn stuff and you go, oh, okay. I
like this.
Now understand why that's happening.
Yeah.
I can understand why that patient is getting these stress fractures and we just can't get them to heal. Do you know, it just helps expand out that breadth of ideas. It's sitting with the radiologists. So, I do vascular meetings with the vascular surgeons, and I've got vascular interventionists. And I'm learning and understanding the principles of when they're doing the angioplasty. So I learned that when I first started in UK. So those things just help expand you. And so when my father-in-law had a dissecting aneurysm, well, I knew exactly what was going on with that. I could sit down and I sat, with the vascular surgeons and really understand what that Stanford B dissecting aneurysm actually meant. It made sense to me. So to me, that makes my podiatry job actually fascinating, because when the patients are giving me that history, I've got, okay, I know what's gone on there. That really resonates with me, and I can, like I put on one of these diabetic patches things, these meters that you scan with your iPhone.
Okay, yeah.
Test your monitoring. Well, I just sort of offered myself up to have a crack at that for 2 weeks. So I could understand what it was like for someone who was wearing them, a diabetic patient who was wearing it, so that I said, I know what that's like. And I couldn't believe what I learned about my body's physiology and glucose management from my insulin when I was exercising and everything else. So you can sit there and connect with the patient that way. I like that. That's what I like.
Yeah, I think that's the difference between, I've said this to people before, the difference between someone who is a podiatrist and it's just a job title, and someone who's a podiatrist but that's their career. And I think the one who takes it on as a career is always on that path of wanting to improve, wanting to get better, wanting to learn more. You don't want to be like, if it's 2023 now, in 2026, if you're the same podiatrist with the same skill set and the same knowledge, you haven't changed. It's been a missed opportunity.
Yeah, absolutely. Yeah. And just the great people you meet along the way as well.
Oh, definitely. Yeah. I think the more things you go to, the better. So Matthew, I want to thank you for coming on the Podiatry Legends podcast and sharing part of your story. And love to get you back at some stage just to see what else you've been up to. And like I said, I'm sure you've got far more that you can share that people would love to hear about.
Yeah. Thanks for having me, Tyson.
No, this has been fantastic. Thank you.
Okay, mate.